In our device and injection center, our 2 registered nurses have been trained by myself and have gone to many, many courses to learn how to best deliver the most optimal and safe methods for injections of filler materials, but also for device treatments. Many of the devices that they are able to provide you are devices that are the first in the country. One of them is Zeltiq, which is the freezing of fat.
Can we start at LT?
Zeltiq or
Zeltiq.
Mm-hmm.
Can we? I think we'll use that as a separate section. So let's introduce it as a separate section. Okay.
Zeltiq, or cryolipolysis, is a cooling of fat. Fat cells will be destroyed if we can deliver the cooling to a level just above freezing. One of the devices that does this very effectively is called Zeltiq. We were fortunate to have the first device in the country because I'm their consultant and have done most of their investigative work to maximize and optimize the treatment. We have 2 devices in the office so that they can be used simultaneously in various parts of the body in a single treatment. The cooling of fat is done in such a way that it is very comfortable for the patient with maximal results with a single treatment. Frequently, however, because of the amount of fat that is present or its location, we have to be able to advise perhaps 2 or 3 treatments. The devices are placed upon the skin and incorporates the fat into the device, and the cooling plates then allow the temperature to be brought down safely to about 9 degrees centigrade. At that particular level, the fat within the cells will crystallize, and by definition, those cells will not survive. And the body on its own will gradually take it away, and the patients will start to see a reduction of their fat content, and they can tell that by the looseness of their belts or in their clothing at about 3 to 6 weeks. Frequently, again, depending upon the wishes of the patient and the amount of fat that is present, we may need to repeat it 2 or 3 times. But cryolipolysis can be done underneath the chin fat. It can be done also for the fat to the abdomen and all the back rolls. And because of the applicators that we have available to us, that we have begun our investigations with, they can be applied to almost any part of the body.